here we will perform a nose filler procedure on a patient who has undergone surgery twice and has also been in a traffic accident. Our goals here differ from classic nose filler applications. Instead of simply lifting the nose or correcting the curvature on the dorsum, we aim to restore the skin's underlying structure, replace the subcutaneous fat tissue, and correct the voids in the cartilage and bone structure, especially in the nasal wings. Look closely, this side appears lower, and there is a noticeable skeletal deformity present at this specific point on the nasal wing. These imperfections will be skillfully corrected using hyaluronic acid filler, which is essentially a non-surgical type of liquid rhinoplasty. Therefore, we will be making injections at different points. These specialized injections should ideally be evaluated by skilled surgeons who routinely perform various nasal surgeries and possess significant experience in administering nose fillers, having completed nearly 500 to 1,000 syringe applications to ensure optimal results and patient safety. In other words, we will be performing a non-standard nose procedure. Our advantage here is that due to the surgeries the patient has undergone, the main collaterals are increased, and some vessels in the marginal wing may be nourished by collateral circulation due to being cauterized or cut during surgery. Thus, small vessels will pose a problem for us rather than large ones. It is unlikely that we will enter these vessels. This represents a benefit. However, there is a significant risk of compressing these vital vessels, much like stepping forcefully on a garden hose. Excessive filler can disrupt blood circulation in the vessels, posing a risk. Nutritional deficiencies may lead to various health problems. Therefore, instead of administering a high dose of product in these types of noses, we must focus on gradually restoring the skin's main structure and subcutaneous fat tissue with fillers step by step. When I show the patient's side view shortly, you'll see that the elevation of this patient's nose is in excellent condition. The nose appears small for the face. Therefore, our primary objectives will encompass not only lifting the nose upward, but also gently extending it slightly forward and modifying it to achieve a more masculine natural appearance that enhances facial harmony. Now, due to the specific camera angle, I will first demonstrate the injection procedure I will perform at this point from below. Initially, I will not inject in the area where the maxillary spine is located because, as I mentioned, the nose elevation is excellent. After completing the work on the nose area, I will assess if any additional injections are necessary for that specific region. How was the classic nose filler? First, we would inject at this point, then inject into the supertip or tip area, properly elevating it, and if necessary, inject into the nasofrontal angle to complete the procedure. Our sequence was like this. However, in cases that have undergone this specific type of surgery, we need to focus our efforts particularly on the precise area where the problem exists to ensure effective recovery and optimal results. We will approach our work in an unconventional way, starting the injection on the nasal wing. Here, I understand that the anatomical line where the marginal artery runs is located roughly 1.52 meters above the line, connecting the nasal wing and the inner mucosal surface. I won't plan an injection based on this approach. I will carefully enter through this specific structure that lies between the delicate nasal mucosa and the outer skin surface. After my needle gently touches the cartilage, I will carefully pull it back slightly by approximately 34 million and remain within the space I have created, which is specifically in the dermis layer. And I will perform the injections at this point. The injections administered now are quite substantial. Your patients will feel some pain. I think of it as if I am placing it in liquid form. Now I've completed the first part of the injection at that point. Now let's lift it slightly upwards. Look, the sharp angle of the line there has softened a bit. I currently have an opening available. I will offer some assistance at that point. Once again, the established rule is to enter from below. And I am injecting the substance at that specific point as well. I am functioning as an expander here. I am trying to create a diffuse round transition by separating the subcutaneous tissue from the cartilage tissue. Look, I'm slowly starting to achieve the desired appearance. There will be swelling, but it will eventually soften. Now I will continue my injection along the patient's nasal bridge. While at this camera angle I can show some irregularities in the nasal bridge, the bony indentations and protrusions. Now I will continue my procedure with a side view. I've reached the cartilage level again. I pulled my needle back. I'm just beneath the surface of your skin. At this point in the procedure, I will carefully project a bit to enhance and highlight the columella, ensuring that the nostrils achieve a more natural and aesthetically pleasing transition. Once again, I carefully went deeper and gently pulled my needle back, meticulously checking for any potential blood vessel issues located about 1 millimeter back from my entry point. It's a procedure we don't think will be very useful, but it gives us peace of mind. Let's do a little bit more work, and at this moment we're actively supporting the structure to ensure it remains stable and secure. I went deeper again and slowly pulled my needle back. And look at this point, the doses I use here in the applications are minimal amounts like 0.01 or 0.02. You can clearly see 0.02 milliliters from my syringe. We do not perform applications in such a quantity of 0.05 ml. We are actively working to make this specific part a bit more rounded in shape and also larger in size. The patient is requesting this direction. We strive to achieve a smoother and more natural transition. Now we want to effectively fill that empty space by carefully pushing the filler forward using the anti-projection technique. We will mold it using our hands. We are back at this point. I'm beneath the fat. I want the fat to rise up with me if there happens to be a vein nearby during the process. I am carefully placing a projection point beneath the fat. I am trying to inflate it. Now I will carefully review this particular point by skillfully massaging it with both hands. The camera operator may not be able to capture this, that's okay. I made this movement. I ventured deeper into the unknown, then I pulled back a bit. I'm elevating this point.